afternoon. Thank you for joining us, and Happy New Year. I guess it was last year, the last time we were all together. We've got a full program, so we're going to get right at it. Dr. Box will give us the latest updates. Dr. Weaver is with us as well, and she'll give us some updates. Dr. Virginia Kane with the Marion County Health Department is with us, and she'll give us an update as well. But primarily the focus of all of our presentations are going to have to do with our vaccination process and how it will continue to roll out from phase to phase, going from 1A to this Friday at 9 a.m. to 1B. We've been working with the Vaccine Advisory Committee, taking our federal recommendations into account, and we'll elaborate more on the next group that will be recipients. That group will end up being, we'll go much further in depth, everyone will, but into this, but we're going to be moving on age group by age group, and Friday at 9 a.m. you'll be able to call in to get information, you'll be able to go online and get information, but we'll start with 80 and older. We know, fact certain, that starting there eats into about 54% of our deaths and just under 20% of our hospitalizations, and then we'll step it back from there down to 70 and then down to 60 and older. And so taking this by age eligibility, we'll keep this not just methodical, but it will eat into where we have the most vulnerable Hoosiers at risk. And that will again start this Friday. The initial group of 80 years or older, while it's 3.8% of our state's population, again, that represents, you shared with me, 52% of the deaths to date. And again, about 20% of the hospitalizations. 93% of the deaths in Indiana and 64% of the hospitalizations from this virus occur in the age group of 60 and over. So that's what we're trying to do, is to get there as quickly as we can, having the inventory or the volume, the doses on hand, and then getting them out to all 92 counties and multiple sites, and ultimately into the arm. You'll be hearing a lot more next week. We'll have a segment on our communication plan, but you'll start to see that as well. It's our shot. Hoosiers will be this communication plan. You don't need to wait for March Madness. This is our shot right now, and we intend to make it. We're going to be relying on a lot of stakeholders. The Department of Health has been working with so many, and you'll, I'm sure, kind of go into that as well, but working with stakeholders all over the state of Indiana, associations that have memberships that are also going to be assisting us. But we're relying on everyone. We're relying on the press. We're relying on your neighbors. We're relying on everyone to get the word out for each age group as we move through this week by week. I say all that, and then I'll turn it over to you. I'm not trying to filibuster, but I say all that. That's good news. That's that light at the end of the tunnel that you talked about a couple weeks ago when we started this vaccination process. But that doesn't take away from, as you see our positivity rate continue to tick up, and you'll probably scratch at this as well, coming off the holidays, we have to continue to practice good public health measures. And, vigilance is just as key as the vaccine is. So one doesn't replace the other. And with that, I'll turn it over to Dr. Box for our latest weekly update.
Thank you, Governor. Good afternoon, Hoosiers. From the outset of this pandemic, protecting the most vulnerable among us and preserving our healthcare infrastructure has been our top priorities. Distributing vaccine is not a one-size-fits-all process. Every state has unique considerations, and that's why you will see some states adopt an approach that focuses first on age groups, while others will start with occupations. We know that people age 80 and older account for more than 52% of the COVID-19 deaths that have occurred during this pandemic. If you add in those 60 and above, you've accounted for the vast majority, or about 93% of our deaths. Indiana has approximately 257,000 residents above the age of 80 and above, and more than 1.5 million who are 60 and older. By taking an age-focused approach, we can accomplish two tasks: protecting those at greatest risk for adverse consequences like death or hospitalization, and then reaching older workers who are more likely to have comorbidities when we move into those age groups in the 60s, 65, 70 range. Hoosiers can rest assured that an incredible team of experts has looked closely at Indiana's data to determine the best way to achieve these goals while our vaccine supply remains limited. We're grateful for their help as we work to get vaccine in the arms of Hoosiers. As we ramp up vaccine efforts, it's important that we don't lose sight of testing and our current rates of transmission. Our testing numbers remain lower than what we're accustomed to seeing, but we continue to see holiday lags in testing. However, we are starting to see the impact of holiday travel in our positive cases. Our overall positivity rate has increased from 15.8% on December the 29th to now 16.3% today. This suggests we're starting to see that post-holiday surge that we've been bracing for. We also continue to see nearly 2,800 Hoosiers hospitalized with this disease and to have more than 350 people admitted for COVID or COVID-like symptoms on a daily basis. While these numbers have largely held steady, many of our hospitals continue to hold dozens of people in their emergency departments because no beds are available. We also continue to lose Hoosiers to this disease at a heartbreaking rate. Today we reported 80 new deaths. That brings our total losses due to this pandemic to more than 8,700 Hoosiers, when you include the probable deaths that have been reported based on clinical diagnosis. That's an increase of more than 600 in just a week's time. We've also seen an increase in the number of counties in red on our color-coded map. This week, 35 of our 92 counties are in orange, and the remainder are in red. This is the map that shows the average score of cases per 100,000 residents and the percent positivity. Our advisory map, which indicates the level of restrictions that counties must continue to follow, shows 27 counties in orange and the rest in red. Keep in mind that a county needs to be at the same color for 2 consecutive weeks before we can loosen its restrictions. I also want to provide you an update on our statewide approach to contact tracing. In talking with our local health departments, we've heard that many are focusing their own contact tracing on immediate household contacts or congregate settings such as schools, where identifying close contacts quickly is critical. This has become more important as the number of cases statewide has grown exponentially. As we ramp up vaccine efforts, we have looked very closely at the best way to use our resources. We've reviewed our contact tracing data and determined that about 60% of our non-household close contacts fail to respond to our repeated calls, texts, or other outreach. Repeated outreach to individuals who aren't interested in responding takes resources away from those who would like to have the contact. We also have seen an increase in the number of cases we can interview thanks to our online interview option that we rolled out a few weeks ago. As a result of this analysis, we have decided that our centralized contact tracers will no longer make outbound calls to close contacts of positive cases. That being said, it is still crucial that close contacts learn of their exposure so that they can take the appropriate steps to quarantine, monitor for symptoms, and get tested. Let me be clear. We are not giving up on contact tracing and notifying people who are considered close contacts. They will still receive an initial text message and have resources and guidance available to them. In addition to local health departments' outreach efforts to those close contacts, we will continue to ask positive cases to notify their close contacts as well. And our outreach to positive cases will not change. These changes will allow us to redirect some of our contact tracers to help answer calls related to registering for vaccine. This is where our current efforts are focused, and we want to ensure that we have people available to help individuals who might be eligible for vaccine but are having difficulty registering because they lack access to a computer or don't have an email address or a cell phone. These changes should not significantly impact our contact tracing, but they will provide needed support as more Hoosiers become eligible for the vaccine. Our goal is to remove any barrier that is possibly there so that the majority of our population is protected from COVID-19 by the end of the year. Before Dr. Weaver provides her vaccine updates, I want Hoosiers to know that the vaccine allocation plan that we provided to the CDC in October is now outdated. From the beginning of our planning for the vaccine rollout, we knew that our plans would evolve based on the availability of the vaccine, federal and state advisory committee recommendations, and vaccine uptake here in Indiana. All updates about additional eligibility will be posted on our website at ourshot.in.gov going forward, so please check back regularly. Now, I'll let Dr. Weaver share more about where we are with our vaccine rollout.
Thank you, Dr. Box. Today, I am happy to report that as of yesterday morning, more than 128,000 Hoosiers have now received their first dose of vaccine, and that nearly 600 have received a second dose and are now fully vaccinated. More than 300,000 Hoosiers are scheduled to be vaccinated by the end of this month, and more people are scheduling appointments every day. So far, more than 500,000 people have been invited as eligible to receive the vaccine. If you are eligible, please consider making your appointment today as we work to slow the deaths and hospitalizations from COVID-19. When we began planning for the arrival of vaccine last year, we submitted a plan to the CDC that outlined priority groups. Our first priority was to reinforce and support our healthcare infrastructure in treatment of disease, which is why we have focused on healthcare employees and first responders. There are approximately 300,000 licensed healthcare providers in Indiana and roughly 100,000 other unlicensed healthcare workers and 35,000 plus first responders. Our second priority was to protect the vulnerable by vaccinating individuals who are at particular risk for severe complications associated with COVID-19 based on the latest evidence-based criteria. We know that in Indiana, age is the biggest contributor to severe disease and death from COVID-19. We have expanded the group of eligible healthcare workers to include a wide group of people. This includes dentists, physical therapists, speech pathologists, radiology technicians, chiropractors, eye doctors, social workers, coroners, and many other health professionals who have direct contact with patients. On December 28th, we expanded to include long-term care residents through a federal program that partners with CVS and Walgreens. The goal of this program is to provide vaccine to any long-term care resident who wants it by early February. This program started with skilled nursing facilities and will be adding assisted living facilities in the coming days. This week, we also notified first responders, including law enforcement, firefighters, DNR conservation officers, emergency medical service providers, and correctional officers within the Department of Corrections system that they are also eligible for the vaccine. We recognize that these individuals are often the first people to encounter a patient and are critical to our ability to provide crisis health care to Hoosiers across the state. As the governor noted, starting Friday, Hoosiers age 80 and older will also be able to register to receive vaccine at one of the 55 vaccinating hospitals or 91 local health departments. Appointments will be available in the coming days as each site is ready to begin or expand its clinics. Each site will set its own hours and days. We will have at least one vaccination clinic in every county in Indiana. We plan to expand this age group to those 70 and older, and then to those age 60 and up. The timing of that expansion will depend on whether we receive the roughly 78,000 doses we expect each week through the end of the month, as well as on the number of appointments that are made. We do expect to see additional healthcare workers start to sign up as well now that the holidays are over. When the scheduling window opens, Hoosiers who are eligible will be able to go to ourshot.in.gov and click on Find a Vaccine site. This will take you to a portal where you will test that you meet one of the eligibility criteria based on your age or profession and live or work in Indiana. You will see a map that shows the locations of vaccine sites and will be able to identify those closest to you, and then will be able to schedule an available appointment. We recognize that some of our older Hoosiers might not have access to a computer or an email address. If you have a loved one who is age 80 or older who needs assistance, you can register on their behalf, so long as your loved one brings a photo ID to the vaccination appointment. Also, beginning on Friday, Hoosiers over age 80 will have another option to make an appointment. These individuals can call 211 and request assistance with registration or even transportation needs so that they can get to their appointment. We have partnered with FSSA to engage the area agencies on aging around the state to call people in this age group and help them with registration or transportation needs. We will also be sending direct mailings to households with a person age 80 or older with information on how to get the vaccine. Offering vaccine to a wider group of people only works if people feel confident in receiving it. I know that many Hoosiers remain skeptical about the vaccine's safety and effectiveness. I encourage you to visit ourshot.in.gov to learn about the vaccines that are currently available. And for the many Hoosiers who are still asking, when can I get my shot? Please know that our goal is to get a vaccine to everyone who wants one as quickly as possible. We have received about 350,000 doses for more than 6 million people. 56,000 doses were given to CVS and Walgreens to administer in the long-term care facilities. The only vaccines available right now are those manufactured by Pfizer and Moderna. The Johnson & Johnson and AstraZeneca vaccines are likely weeks or even months away. So this rollout will take time. Keep checking our website for regular updates as we expand eligibility based on the vaccine that is available. We will keep you informed every step of the way. Now I want to introduce Dr. Virginia Kane, the Marion County Health Officer. Dr. Kane has been an incredible partner throughout this pandemic. She serves on our Vaccine Advisory Committee to help determine vaccine prioritization. She is also an infectious disease doctor and works with many at-risk populations who may be hesitant about the vaccine. So we are very fortunate to have her share her perspective.
Thank you, Dr. Reaver and Dr. Box and Governor Holcomb. This deliberate plan of making vaccine available next to the populations of 80 and older, then 70 and older, and then 60 and older is the right approach because it targets the population that is most likely to be hospitalized due to COVID-19 or die. So as we move through the age groups that the governor and Dr. Weaver outlined, you need to do all you can to protect our vulnerable populations and the people on the front lines. I am part of the State Department of Health's External State Vaccine Advisory Committee. We review constantly the federal committee's information and recommendation in light of what's happening across the country. But most particularly, we make recommendations related to what's happening in Indiana in our respective communities, and we try to determine what's best for our Hoosiers. So this committee has brought lots of people together. If you could see the extent of the expertise that's been on these advisory groups for the state of Indiana, your comfort level and the amount of investigation and reviewing science-based, evidence-based studies makes our contributions to this effort on behalf of the state government, I think, a winner for Hoosiers in our community. We have to continue to be vigilant. We must do outreach in our communities to educate people why it is so important and why they need to take this vaccine to protect yourself and your loved ones. People don't realize that to have a COVID-19 infection may leave individuals with some long-term effects. So where this virus gets across the blood-brain barrier in our body, it can impact our brain, our heart, and other neurological conditions related to this infection. You can even lose your hair related to having a COVID-19 infection as a long-term impact. I know the men don't worry about this, but ladies, some of you may be concerned about this. But, you don't want to have chronic memory concentration problems. Some individuals, as a result of COVID-19, will have chronic fatigue syndrome that can last for months, increased anxiety. And so why take the chance of being one of those individuals that may have what we call brain fog that may last persistently with lost taste, lost smell, and other complications related to COVID-19. Be safe. Help us through the education that we need. an effort to reach the people who are most impacted by this and remove any barriers to them receiving the vaccine. Thank you, Dr. Weaver.
Thank you, Dr. Kane. Rachel, let's just jump right at it. We got a lot to go over.
Rich with WTHR.
Good afternoon, Rich. Thanks for joining us.
Good afternoon. Can you hear me, sir?
Yes, sir.
Thank you very much. I think the big question for the doctors is the frustration people have if things aren't going faster. Are you limited by resources such as manpower, or are we just not getting as much vaccine as we counted on?
Dr. Weaver, you want to take that one?
Sure. So I believe that we definitely have the infrastructure in place to be able to provide the vaccines that we have been allocated. We, of course, would love to have more vaccine and are limited in that, but we will use every single vaccine that is sent to us. You know, we've been very deliberate in our allocation plan, have been planning for months, working with our hospitals, our local health departments, and all the experts and leaders that Dr. Kane just referred to, in order to get vaccine as quickly but also as safely into the public. And that includes, part of that is education, so that people are confident when they are getting the vaccine. And that's why at this point we are confident in opening up eligibility to this 80+ group and hope to move through these decades as quickly as possible, as long as we still have vaccine available.
Samantha with WFIE.
Yes, Samantha, good afternoon.
Good afternoon, Governor. Can you hear me okay?
Yes, ma'am.
Perfect. Thank you. Communities outside of Indianapolis, specifically here in our area, have unused vials of vaccines ready to be distributed, but they're sort of waiting on the state's permission to move forward with the vaccination process. And I know that you guys had mentioned, obviously, it's not a one-size-fits-all plan among our states, but have you guys considered maybe giving permission to specific counties or hospital systems to give them the power to make the decision to go ahead and move forward in the vaccination process?
Now, this is a little bit of a nuanced answer, but we have. But Dr. Weaver, you want to talk about the authority that the locals have so that it's not being wasted or sitting on a shelf and expiring?
Right, so we definitely do not want any vaccine wasted. And so we have communicated very carefully with the hospitals a plan about not to waste it. And then when you're talking specifically about they have vaccine available, but maybe not the people to fill it, there are counties who every single vaccine appointment is taken and other counties where they are not. So again, constant communication. Do we need to move vaccine around? Do we need to open up other spots in certain places? And then also, you know, with this eligibility plan, we've communicated that with the hospital, so they know that we are now expanding more into this public arena, and we've discussed with them, you know, here are the different groups. Have you reached out to every single healthcare worker in your community, every single first responder, and now what are we doing as a local community to make sure that we're reaching all of our 80+ so that we can get those vaccine spots filled?
Sherry with the Indianapolis Star.
Hello, Sherry.
Hello, thank you for taking my question.
Sure.
So what happens after 60? Do you have a vision? I mean, 60 years of age? And what's sort of the time frame for what you expect?
Yeah.
And again, there is this notion that states now have all this vaccine that's not going into people's arms. Is that just a matter of sort of hangups during the holidays, or, you know, kind of asking a little bit different version of what was just asked? Do you always expect there to be large discrepancies between how many doses the state has versus administered?
Do you want to take that and I'll follow up? I've got some thoughts too.
Certainly,
But
and I think
you both
Lindsay,
look like you have something to say.
I'm sure Lindsay will want to comment on this, but no, we don't expect that we're always going to have large amounts of vaccine that is sitting around. And to be quite honest with you, by opening this up to these age groups, you know, once we get to 60 and above, that's 1.5 million doses, and we don't have that many doses or expect that many. So we realistically are trying to just parson this out bit by bit and group by group to make sure that our most vulnerable population does get vaccinated first. Lindsay, do you want to talk a little bit more about when we get to that 60 age group, what you'll be looking at?
Yeah, look at your crystal ball. Wall, Lindsay.
Yeah, I mean, right now, again, we are really concentrating on saving lives and reducing hospitalization. So once again, to underscore, if we vaccinate every Hoosier that's 60 and older, that's 1.5 million people. And so it'll be quite some time before we get that vaccine in order to do it. But it will hopefully save 93% of the deaths in Indiana. So that is really what we're working on now. But of course, our advisory group have already discussed kind of what are the next steps, where are we going? And really it depends on how much vaccine do we have available then? Have these other vaccines come on board? Will it be a small group of people? Will it be a large group of people? And so we'll take in the same things that we've taken into account when we've made our recommendations so far, and that is, what is the risk of morbidity and mortality? What is the risk of exposure? What is the risk of exposing other people? And we talk about it over and over again in our advisory committee that Dr. Kane sits on, and that's how we'll make our determination for our next group.
And Lindsay, the volume or the inventory that we are expected to receive on a weekly basis is just under 80,000.
That's correct, just under 80,000. And not all of that is going out directly to our hospitals and local health departments, because we are, like I said, allocating a good portion of that for our long-term care facilities. That includes our assisted living facilities very soon. So right now they're concentrating on our skilled nursing facilities, and then, like I said, we'll move on to skilled nursing.
Yeah, and I think, we are trying to do this as swiftly and as fast and safely as humanly possible. But I think Sherry brings up a good point about this was starting to roll out right around two of the biggest holidays during a pandemic. And then also there's a number of folks, just anecdotally, that are taking a more cautious or wait-and-see approach. And so this could, as more and more people come online and get it, and folks understand the efficacy of it, than we're expecting to, so we don't want to outkick our coverage, so to speak.
Kathy from the Ferdinand News.
Happy New Year, Kathy.
Happy New Year to you too. I have two questions. One slightly selfish. I've been 29 for 35 years now.
Happy birthday.
Third group, but I'm diabetic, and I'm really speaking for all the diabetics and all the people with heart conditions and things like that are under 80. Excuse me. And I wondered what the sort of was the plan, or will those people be added in possibly, or wait their time as like me when they hit the 60 age group?
Well, and I think definitely when we get down to that 60 age range, that's part of what we're looking at, right, Dr. Weaver, is other comorbidities that individuals may have, whether that's obesity or diabetes or heart disease and other things. So that will be a critical part of what we're looking at and what Dr. Weaver and her external committee will be reviewing.
Thank you. And Governor, my question for you, I'm sure you're watching what's going on at the Capitol. And I just wanted you to possibly comment on that and what's happening with this country right now.
Yeah, Kathy, honestly, I mean, from afar, I've seen reports. If you're talking about specifically today, I've been informed, but I've not had the TV on myself. I'm of two minds about this time in history. I'm reminded about in the 60s and early 70s, we were going through a pretty rough patch as well. And when you think about Martin Luther King and RFK and JFK, Vietnam, the 68 Democratic Convention, Kent State, as a string, I'm pretty thankful my parents were optimistic about the future, and I maybe get it from them. And this country is strong and resilient, and to me this is a reminder for all of us that we can ourselves model good conduct. We can still fight for our country in a very responsible and compassionate and heartfelt way, and we should. But we've been here before. We were here in the 1860s, we were here in the 1960s, and maybe we're just a little premature 100 years, a century later. But we're going to get through it. But it's going to require folks to step up and show there's another way, and there's a productive way, and that we need to stick to those principles that made this country great and unique and exceptional in the first place.
Eric Berman, WIBC.
Good afternoon, Eric.
Good afternoon, Governor. Sort of a running theme today, I guess, about getting more vaccine into arms. Is the problem, how far along are we in terms of that first group, the healthcare workers? Are we satisfied that we've reached all of them, or if not, when do we anticipate that everyone who wants it will have gotten it? And related to that, is the state hanging on to doses to make sure that it has enough for the second dose, or are we assuming that each week's shipment is going to cover that as we go?
Yep, two good questions, and we probably all have a comment on both of them, but
Dr. Weaver.
Dr. Weaver, you want to go first?
Yeah, so we have vaccinated, honestly, by the end of today, it's going to be 140,000 people. So the number that we put up on our website is pulled as of yesterday morning because we want to certify that it's correct. But then we knew that we had over 10,000 scheduled for yesterday. We have over 10,000 scheduled for today. So we are moving very quickly. So 140,000 of the roughly 400,000 healthcare providers. And as I mentioned, we have 300,000 appointments scheduled out through the end of the month. So that is, over 50% of our healthcare workers, and then you add in, that 35,000 for the first responders. So of the 350,000 doses that we have been allocated, we have 300,000 people who have either received their vaccine or are scheduled, and then, like I said, that other 50,000 plus has been allocated to our long-term care facility. So really, we are accounting for all of our vaccines. That's why it's the perfect time to go ahead and open up for expanded eligibility so we can start moving through these other populations.
Yeah, this is what you talked about a month ago, both of you, but when you hit a certain saturation rate, you don't want to wait or linger in one area. You want to, because you're going to have people of that 300,000 that have already scheduled, you're going to have a certain number that just don't make their scheduled appointment that you're accounting for. And so we're going to continue to be nimble. Eric, you had a second question?
Oh,
what was his second?
I got it. It was about the second dose.
Oh, yeah.
So we don't have to account for any of the second doses as far as holding doses back here in Indiana. The federal program ships the second dose 21 days after the first Pfizer shipment or 28 days after the Moderna shipment. So all of those are kind of scheduled out and planned, and our partners all know the process and know that they don't have to hold any of their doses back.
Rob Burgess of the Wabash Plain Dealer.
Rob, long time no talk.
Yeah, absolutely. It's been 24 whole hours. It's amazing. Almost. Yeah, good afternoon on this slow news day.
Right.
This is for any of the doctors. Now that you've administered thousands of these vaccine doses, have you seen any cases of anaphylactic shock, which have been reported in other states? What should people who have suffered similar reactions or might be susceptible to them know about their potential for these reactions themselves?
Mm-hmm.
So, and Lindsay can correct me if I'm wrong, but we have had one anaphylactic reaction where an individual was hospitalized and treated and did extremely well with that. We've had other minor reactions, which can be expected, a little bit of heart racing and, itching and palpitations, but nothing very severe with regards to the administration. Lindsay, I don't think there were any additional cases, right?
You want to, Dr. Weaver, Dr. Box, or Dr. Kane, or Dr. Dan is with us also, by the way. You want to talk about, just so that Hoosiers know, when they schedule their appointment and then when they arrive to get the shot in the arm, how long it takes, what needs to occur before they're going home.
We've actually had this question. It's kind of like, why does it take 15 minutes? Well, it is the administration of a vaccine, and you really are supposed to administer, intramuscular injections and watch an individual for at least 15 minutes. If an individual has had a prior history of an allergic reaction to a medicine they've been given, then we lengthen that to at least 30 minutes, and if they show signs or symptoms, it could be longer. So it's not something that you schedule and think you're going to run in 3 or 5 minutes and have it done and come out.
Be on your way.
Right.
Lindsay Erdody, the Indianapolis Business Journal.
Afternoon, Lindsay.
Good afternoon. Kind of following up on a question that's been asked a couple different ways now, so I apologize. But you said, nearly all of these 350,000 doses we have either have been given or scheduled out. But we have so many of these doses now that haven't been put in arms yet, and more keep coming. So why are we waiting? Why are we giving people, all this advanced time to schedule this out when we have the doses on hand right now? I've heard reports of other places where it's very little time warning for people, like this is your time, come now, or, we're moving on. And then I know you said people can start signing up on Friday, but when will those appointments actually be?
Well, they could be.
They could be this
They could be
weekend.
Friday, yeah. I mean, they could be Friday after 9 a.m. To be scheduled for the same day. That infrastructure is built. But you also want to talk about, maybe either of you or Dr. Kane as well, keeping in mind this is a 92 county effort, and we want to make sure that we're close to everyone. So it's not like you just move 40,000 doses and say come one, come all, and then people camp out like they're at a Purdue IU basketball game before, and pitching a tent.
Yeah, Lindsay, you might mention how we have made sure that every county will have access to vaccination, and how you have filled a couple of counties that didn't have a hospital or a local health department.
And Lindsay, when they go online and they go to that website, can you talk about what they see and their options or choices?
Yeah, so we will have a vaccination location in every county, whether it's a hospital, local health department, and we do have 2 counties that will actually be covered by a pharmacy. And so when you go onto our website, you will see that there is a location in every single county, and then you'll be able to click on that spot, which will then send you to the attestation. So you'll have to attest to the fact that you meet one of the criteria, either you're 80 plus, or a healthcare worker that is patient facing, or a first responder, and then you'll have to actually attest again, and at that point you'll give your zip code, and it'll show you which locations are closest for you to be able to schedule at, because we do want it as easy as possible. We've all heard reports of people sitting in line, whether in their car or on the sidewalk, for hours and hours and hours, and then still not being able to get their vaccine. We don't have the weather here in Indiana to be able to tolerate that, so we are really happy about our process and that it is efficient. And the other thing I want to say is it's safe, right? We want to continue to space people out when they're coming in to get their vaccine, so that isn't a potential time of exposure, and really make sure that we're taking care of those vulnerable populations. So, I'm really excited that we're moving forward, that we're going to be able to get people in. We're happy that it's going to be all over the state so that it is close and convenient as possible.
And Dr. Weaver, correct me if I'm wrong, but you said 2 counties are using a pharmacy because they don't have hospitals, right?
Yeah.
It's not that we didn't go to a hospital. There was no hospital in Posey and Newton, maybe?
That's correct.
Yeah.
Michael from WBEZ.
Good afternoon, Michael.
Good afternoon, Governor. Nice to hear from you again, and Happy New Year.
Yeah, Happy New Year.
Maybe this question is more for Dr. Box. After somebody gets the vaccine, are they being tracked for any side effects or allergic reactions? And is it being reported to the public on the rate of those experiencing side effects? Not to make people more fearful, but at least for that information. And also maybe for Dr. Weaver, what is the percentage of Northwest Indiana healthcare workers who have been vaccinated, and how many healthcare workers are there in this area? And I have just one more question. I apologize. There's been some discussion about whether undocumented workers at meat processing plants will be eligible to get the vaccine. Do we know what the policy is in Indiana, primarily because of that big meat processing plant in Logansport? Thank you.
So David
I will answer the last question and by telling you that if you live or work in the state of Indiana, you'll be eligible for the vaccine. We don't collect or keep information about an individual's citizenship. With regards to adverse effects, there's a couple of really neat things. There's an app called vSafe that you'll get information about when you go to actually get your vaccine. So in addition to watching you for 15 to 30 minutes, if you're doing well and you have no issues, you can go on this app and actually sign up and they will send out a couple times a day queries asking you how you're feeling, how you're doing, if you're having any adverse effects or issues. The other thing is there's a system called VAERS, which is basically adverse events reporting system that the CDC has had in place for many, many years now for any vaccine. And they are specifically also keeping specific information for pregnant patients that are getting the vaccine. So the CDC is collecting that information and will be giving us information back with regards to that. Lindsay, do you want to answer the other question?
Dr.
Yes,
Wu,
the Northwest Indiana question. So if you go to our website, you can look at the map, and we do list per county how many people have been vaccinated there. Right now, you know that the vast majority of those are going to be healthcare workers, because that's mostly who have been vaccinated at this point. We do have percentages and estimates based on how many healthcare workers we have in each of the counties. And again, those are estimates because we only have access to licensed professionals. And then again, we kind of do a 3-to-1 ratio there. So we do track and we monitor that stuff, but I don't know the specific numbers for Northwest Indiana.
Nikki with RTV6.
Good afternoon, Nikki.
Good afternoon. Happy New Year to everyone. I hope everyone's having a happy, healthy, and safe New Year thus far. I know this question was asked a little bit before, but I wanted to ask it again. As far as timetable goes for that 80, 70, and 60 age range, are we looking at this taking a month, 2 months? By the beginning of March, we're going to be moving on? Do we know that at this point? And I also wanted to ask, are there any discussions for mass vaccination sites? I know other cities and other states are doing so. Any discussions on that and where those could possibly be?
Let me pull up the ebook real quick.
Dr. Weaver?
Sure. So as far as timetable, I mean, we want to move through these populations as quickly as we can, but it 100% depends on uptake, and how much vaccine we get. So we are projected to get this, around 70,000, a little more than 70,000 every single week, but we don't actually get that confirmed until the week of. So it will depend on our uptake and how we're seeing our appointments scheduled out. Someone mentioned earlier too, why are people scheduling so far out if you say 300,000? Well, remember, we did ask Hoosiers who have had COVID to wait 90 days to get their appointment, and a lot of our healthcare providers have been affected by COVID. So I am not surprised, and I'm one of them actually who had COVID back in November, so I am waiting diligently for my 90 days, and that may be a reason while they're spreading out, or who knows what the reason are, but we still want to make sure that the vaccine is eligible for them when it's the right time for them to take it. As far as mass vaccination sites, almost all of our sites that we have right now are technically mass vaccination sites. They are set up to be clinics that can move patients through in a fast manner. So it's not the cars that maybe you see, but for example, one of the sites here in Indiana can put 1,000 people through in one day. So technically meets the criteria for that. Also, a lot of our local health departments have plans for very large mass vaccination sites, large numbers and throughput. We just don't have the vaccine to get to that point right now.
It was the
Justin with the Westville
Holcomb
Indicator.
the casino.
Afternoon,
It was
Justin.
posted about 11:30 last night.
Good afternoon,
It came
Governor.
from
A growing number of
Lindsay's,
states are finding cases of the more infectious
interview.
B.1.1.7 strain of
Is that something you
COVID-19.
added at the
What
last
type of
minute
surveillance
to
efforts are
show?
public health officials in the state of Indiana taking to identify whether this strain is spreading within our borders? Particularly, how many samples are being sequenced each day, and if this more infectious strain is found here, does this change the current strategy?
Those are the kind of things that you really want to communicate.
It's an excellent
with
question,
David
and yes,
make
we
sure that
are
he's
doing
aware,
surveillance
because
for
he
this
probably
through
could
our
post
lab
that a lot
and
earlier
have
in the
found
evening.
certain tests that have been done that have
Even
some
if you
markers
just send
that
him the
could go
script
along
to
with
go
this
off of or
mutation.
something like that, you
And
said
so
just
those
pulling out
then
an
need to
extra
be
shot
what we
from
call
the interview.
genomic sequence, which means that
Anything
we
that
look at their
helps him,
entire
get it up. That way,
genetic pattern
for
to make
one,
sure that it is truly that mutated virus. So those have
it's
been
more
actually
local
sent off,
content
and
for us earlier in the
Lily,
evening,
Governor, once
too.
again, is stepping
Then
up
you
to
don't
do
have
that
to
for
scramble
us,
to
and
try to
so
get it
they
posted
are
to the
currently
web.
analyzing those, and we expect those back
11:30
sometime
when
in the
you're
month
ready
of
to go home.
January.
So just make sure that you guys are
Kayla
communicating.
Sullivan with WXIN.
Don't forget about
Good
David
afternoon,
over
Kayla.
here in the web office.
Good afternoon. I have two questions. My first one, some recent ISDH data we got, almost 3,000 residents of long-term care facilities have been vaccinated.
That was our top-
51,200
that was our
doses of the
top
Moderna
performing
vaccine
story
have been
today,
allocated to
and
long-term
stayed
care
pretty steady
facilities.
most of the
So that
morning.
means
That's
less
one
than
of the reasons
6%
that
of the doses have been
I
administered to our
and I
most
noticed
vulnerable.
how
Why
it was
is that?
posted, And I noticed that you had posted it.
Lindsay, you want to give the update on?
So,
or
I have that,
Okay.
Governor, is that all right? It's
More
divide
than-
and
more
conquer
than.
here, sir. So, it's an excellent question. Remember a couple of things. Number one, we have had a lot of our long-term care residents that have been infected or are infected in the recent past with COVID-19. So we don't want to turn around and give them the vaccine right at that point in time. And many of our long-term care staff have also gone to hospitals to get their vaccination as they wait for their facility to be vaccinated. We do know that 505 of our 534 long-term care facilities have already been scheduled, and the current plan has the CVS and Walgreens being to all of those sites by February the 6th, I believe. So the first week of February, the first dose of vaccine will be in everyone that wants that. We have been talking about the uptake and are really doing further education within our long-term care facilities about the safety and about the efficacy. And we do believe that we will see that continue to increase as we do more and more residents.
I think she hit us.
Yeah, it was definitely a good.
Kayla, did you have a second question?
So, that was a good idea, Matt.
Maybe not.
Oh, hi. Yes, I do.
Okay.
I was unmuting myself. So as of yesterday, CDC data showed Indiana has only administered 28% of the COVID-19 vaccines distributed to the state. But that rate was lower than surrounding states when we checked the data. So Ohio was 45%, Kentucky 35%, Illinois 32%. Why is Indiana behind? And do you feel like the speed of the vaccination process in Indiana has been going quickly? What are your feelings about how it's been going so far compared to other states?
I know Dr. Weaver is very anxious to answer this question.
I think that's all I got for today, but.
Thank you, Dr. Box. So the CDC data that reported 100,000. So just like every other kind of reporting function, there is a delay in what they're reporting. So while they know immediately how much we have been allocated for every single week, they're not getting that daily report of actually how many people we've vaccinated. So like I said, by the end of today, it's going to be 140,000. But depending on what day they pull the data, it's going to be a smaller amount. So we feel very confident in where we're at and how we're moving through our vaccine. But, you know, I can't control at what time and how they're getting and pulling their data.
Michael with WKVI.
Afternoon, Michael.
Good afternoon. What resources is the state providing in response to the outbreak at the Marshall County Jail? And are there any specific challenges or concerns from your perspective there?
Well, we are working very closely anytime there's an outbreak at the jail with Dr. Kristen Doss from the Department of Corrections, with our local health department in each of those counties, and with our team here at the Indiana Department of Health, not only to do additional testing, but to make sure that they understand how they can cohort those different individuals that are sick or test positive. So I can't specifically relate and tell you the numbers associated with that, but I don't think Dr. Doss is here today, right? But I do know that we are intimately engaged each time there's an outbreak in one of the jails.
It's better than engineering.
Tom Davies with the Associated Press.
Afternoon, Tom.
Hello, Governor. Good afternoon. Do you have any feeling yet on what percentage of healthcare workers or long-term care residents have not been willing so far to get the vaccines?
Well, you can take that a couple ways. Just because they haven't doesn't mean they're unwilling. But Dr. Dan, I bet, is taking center stage here. You want to comment on the percentage, Dr. Dan, of who has, and then speculate on what's to come?
Right before the vaccine was approved, we had sent out an anonymous survey to the long-term care staff, particularly the skilled nursing staff, asking them if a vaccine was available, would you take it right now? And if not, would you take it in the future, and why not? And we have actually put that out in publication. The lead author on that was Dr. Unroe, who we work with in Probari. And what we found in that was that 45% of the staff at that time said they would take it right now. And an additional about 25, just under 70% total, said at some point they would take it. So we had about 70% of the long-term care staff saying that at some point they would take the vaccine. It's been brought up before, but it's important as we kind of look at those numbers to keep in mind that long-term care staff can get the vaccine in two locations. They can get it at the facility with pharmacy partnership. They can get it at the hospitals or any of the community sites. And in addition, if a staff has had COVID and is recovered, some of the facilities may be staggering when their staff get doses, so that if you've recently had COVID and are recovered and considered at this point immune, you may wait for that second visit of the pharmacy to come so that you don't have all the staff getting the vaccine at the same time and potentially getting symptomatic. So we'll have to look at all those numbers kind of collectively. But right now, the best information we have is about 70% of long-term care staff, when surveyed, said that either right away or at some point in the future would be willing to get the vaccine.
Steve with KPC Media.
Afternoon, Steve.
Good afternoon. How are you doing today?
Doing good. Yourself?
Good. Two questions. I just wanted to clarify with the signups opening on Friday morning. This is primarily for people 80 plus outside of long-term care facilities. The long-term care facility residents will be...
Steve, you should still be able to speak. Oh, we've lost Steve.
We lost Steve, but I think we got the gist of the question, the first question.
So the answer to the question is yes. So I forgot the question now, Governor.
If someone calls or goes online 80 plus coming up on Friday, is it targeted to them?
Correct. So most long-term care residents are not as mobile. It is more difficult for them to get out. So most of our long-term care residents will get vaccinated while they are at the long-term care facility as Walgreens and CVS and our federal partnership come around. However, we may see individuals that are in our assisted living and individuals that are in independent living or senior housing that actually come out and get this at the local health department or the hospitals in the near future.
Dan Klein, Wish TV.
Afternoon, Dan.
Good afternoon, Governor. Thanks for taking my call. I have two questions for you. Just probably a different way of asking this question, but several people in healthcare have been surprised by their ability to get a vaccination in the same day as they call. They expected a longer wait. Does that mean that perhaps more vaccinations should have been out? I mean, that's kind of the immediate reaction I think of when I hear that, is that, boy, we should have more vaccinations out there. Can you kind of speak to that is my first question. Second question, a lot of people very upset to find out that the unemployment situation and the vouchers, which expired the day after Christmas, and the current guidance is you're waiting on guidance from the federal government. Any idea on how long that will take before you're able to provide more guidance to people who lost some of their unemployment benefits?
As soon as we get the guidance, we will have it out in the public domain. We are in, again, constant conversation with seeking that guidance, and we're looking forward to processing. But we have to have that guidance before we go down that road. Fortunately, our federal partners have made funds available, so we know that's the good news. But to your point, we can't start writing checks that can't be cashed. So first things first, but we are daily, the Department of Workforce Development, Rachel probably write down a note to put Fred Payne's name on for next week. And hopefully we have an update before then. You want to speak to the...
Yeah, Lindsay may want to answer that because I know she's very, very engaged with the amount of vaccine that we have received and the amount of vaccine that the hospitals have access to in their appointments.
Yes, with each week we have expanded eligibility to different groups. So the first week it was hospital-based and long-term care staff because we know that they have been profoundly affected by this. And then we quickly moved to our EMS providers. Same thing, they provide care in people's homes, and then of course transport, so had high exposure. The following week we sent out over 300,000 invitations for people to get vaccinated through our associations and through PLA, and of course asking people to share that link with their unlicensed colleagues in their facilities. And then on Monday, we opened up to our first responders, and today we're expanding to 80 plus. So I don't think it's necessarily a bad thing. People are happy with the satisfaction that they are able to get on, easily register, nice process, go in, get vaccinated in a place that's safe, and they're confident in the process. And I hope the same with now that we're moving to this more public groups. And like I said, we'll continue to move through the vaccine. You know, I quickly did the math because I know that it was reported that we were at 20-something%, but 140,000 of the 350,000 we've been allocated. I mean, quick math is upward closer to the 40,000%. So we'll continue to work to make sure that what's being reported is getting reported as quickly as possible. And then, of course, make sure that we will do everything we can to get vaccine appointments filled, again, in a safe and effective manner.
And we're encouraging, if you're 80 or older, come Friday at 9 a.m., get scheduled to take the vaccine. That's about 250,000 Hoosiers.
Right, and maybe we should mention that we are sending out cards to every Hoosier over the 80 years and older next week to remind them that they are available to get the vaccine and how they can go to 211 or go to the website and get registered. We are working with AARP and AAA, so the area agencies on aging, and they are going to reach out, even call their individuals that they work with on a regular basis, and not only offer to help register them if they need help, but give them transportation if they need that. We have asked our pharmacies to reach out to their individuals that do their pharmaceuticals with them that are over the age of 80 or older, and they can do that either through text message or the home phone calls that you get telling you your prescription's ready. So we are really getting this information out besides just this press conference on Wednesday afternoon.
And again, next Wednesday at 2:30, we'll have more on this. We'll be able to show some of the...
And Dr. Kane, I think, has some additional...
Yes.
For local health departments, a lot of us do a lot of community engagement, and we interact with a lot of civic and community organizations. So we're going to be reaching out to our faith-based organizations to say, any of your constituencies over the age of 80 and meet any of this current criteria, please come and utilize our sites. So with the civic organizations we work with, faith-based, we're going to really try to broadly get that message out using local media, our print information. So look to see a lot of local health departments subsidizing and emphasizing this effort of getting people registered. The other thing I want to point out is that a lot of our local health departments, in our regions, we kind of work together. So you may have some of those appointments that are already out to April in some counties, but a county right close to it, like say such as us, if we have some free spots, we'll say, hey, don't wait till April. You can come over to our sites. We got some free sites, and I may be able to take you earlier. So we're trying to do that broad communication, to do as much outreach as we can and as quickly as we can, working together. We're doing that through the state and our local health departments and our regional counties.
And our media campaign that will be rolling out.
Rush, and mobile units at some point.
Our final question is from Nikki Kelly with the Fort Wayne Journal-Gazette.
Happy New Year, Nikki.
Happy New Year to you. The questions. The first was, I understand that a timeline is difficult, but I'm wondering what your goal is.
Mm-hmm.
What month we might have people being up vaccinated if we continue to get the projected amount of vaccine.
Yep.
And then I have a second question after that.
Yeah, I'll make you both cringe, but we're talking weeks, not months, first of all, to get down to that 60. But Lindsay, you want to provide a little more background on why I'm bullish on that?
No, I am too. We really would like to move through this as quickly as possible. I hope that there's such good uptake that it's not just a couple of weeks. So we're really looking to February, where we're going to be expanding it. But if it comes sooner, it comes sooner. And it'll be how many people are stepping forward to get vaccinated.
These are big. I mean, these are the most vulnerable. This is the most at risk. 1A, taking care of our front line, and 1B, the most at risk. Nikki, you had a second question, I'm sorry.
Yeah, the second one has to do with the COVID liability legislation moving through the legislature. I wanted to know if the NCAA expressed any desire to have that through before the tournament comes to Indianapolis.
No.
Thank you.
You're welcome.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.
Oh, is it finally over? Just